And just a heads up, folks, we are now live on YouTube.
Thanks, everybody, for joining us here. We're just going to hold tight for a little bit more as people file in for our town hall on mental health with the Washington County Board of Commissioners. So stay tuned here while we let some more people file in. Thanks, everyone, for joining this town hall meeting with the Washington County Board of Commissioners. We're going to let a few more folks come into our Zoom session here, and we'll take care of some announcements in just a moment. All right, I think we're about ready. Hello, everybody. Welcome to our town hall meeting. This is the second of 4 quarterly town hall meetings with the Washington County Board of Commissioners. And we're going to focus on mental health this time around. We're so glad you're here. And my name is Philip Bransford. I use he, him, his pronouns. I'm the communications officer with the Washington County Administrative Office. So I'll be serving as your moderator this evening. And right now, before we go much farther, I'm going to ask our Spanish language interpreter, Jennifer, to provide some instructions in case there's anybody in this meeting that would prefer to hear the conversation in Spanish. Jennifer?
Thank you. Hola, buenas tardes. Para todos los que quieran escuchar interpretación en español, se pueden ir a la parte inferior de la pantalla. Ahí van a poder ver un circulito que dice Interpretation, que significa interpretación. Seleccionando este circulito, van a tener 2 opciones, English o Spanish. Asegúrense de seleccionar Spanish, que significa español, y así van a poder escuchar la interpretación en español. Si están en un teléfono, pueden tocar su pantalla una vez y van a ver 3 puntos en la parte inferior a mano derecha. Seleccionen los 3 puntos y en ese menú va a salir como Language Interpretation, que significa interpretación del lenguaje. Seleccionando esta opción, de nuevo van a tener 2 opciones, English o Spanish. Asegúrense de seleccionar Spanish, que significa español, y así van a poder escuchar la interpretación en español. Si necesitan ayuda accesando los canales, nos pueden dejar saber y así les vamos a poder ayudar. Nos pueden dejar saber por medio de la caja de charla. Muchas gracias. Thank you so much. I am ready to be assigned as an interpreter.
Muchas gracias, Jennifer. Thank you, Jennifer. While you move into your new role here, I will also ask our participants that have signed up today for this town hall meeting to go to the bottom of your screen in your Zoom session, and you should see a globe icon. And if you would please click on that icon and select English, this will enable our Spanish-speaking participants to ask questions real time as we conduct ourselves today. So if you would please go to that globe icon down there at the bottom of your screen and select English, that'll enable everyone to participate in our session. So thank you for doing that. And again, I'm Philip Bransford with the Washington County Administrative Office. I'm also thanking our American Sign Language interpreters who are helping today as well. We have a really interesting town hall for you focused on mental health. And as you can see on this slide, we are just finishing up our housekeeping, and we're going to pivot here soon to hear a presentation from a key staff person in our Health and Human Services Department. That's only going to last 15 minutes, a lot of important information to set up our conversation. but most of the time tonight will be spent engaging with your Board of Commissioners. I think we have about an hour. So I'm very thankful to our board for helping with that and being available to the community, particularly during that question and answer session. Chuck, if we can get the slide to move forward one. So tonight we are here to participate with intention, appreciating the diversity of perspectives and of people that have joined us for this conversation with the board. We want to make this a respectful place for everybody participating. And we want to create an opportunity for everyone to engage. So to that end, we're only going to have one question or comment per person. I see that the numbers have grown as we've just been talking here. And we want to make sure that everybody gets a chance who wants it to engage with our board. So one person for a question or a comment in our question and answer segment. I'll also point out that the slideshow that we're presenting here will be sent out in English and Spanish. We'll have that on our county webpage later on. It has been sent to anybody that's RSVP'd in advance. So thank you, staff who helped with that. And without further ado, I would like to go to the next slide and have our Board of County Commissioners introduce themselves, keeping in mind that we were trying to save the balance of the time as much as possible for the Q&A segment. But starting with our board chair, if you would please introduce yourself with your name and the geography that you represent. And we'll just hand it on down the line there in sequence, as you can see on the slide. Chair Harrington, would you please go first?
Good evening, everyone. This is Catherine Harrington, your elected chair for the Washington County Board of Commissioners. Thank you for joining us.
And good evening, everyone. My name is Nafisa Fai. I am the Commissioner for District 1 and look forward to this presentation and this conversation.
Good evening. My name is Pam Treese. I'm Commissioner for District 2. I really appreciate everybody's attendance tonight, and I look forward to the presentation. Over to you, Commissioner Rogers.
Thank you, Pam. I'm Roy Rogers from District 3, which is roughly the southeast quadrant of the county and about 6-7 cities there. To you, Jerry.
Thank you, Roy. Jerry Willey, Commissioner for District 4, which is mostly the western side of Hillsborough and moving on out into rural Washington County.
Thank you, board. That was so cool. Much cooler than the temperature outside right now. You did a great job introducing yourselves. So why don't we carry on? And if I could have the next slide, I want to introduce you to Nick Oconne, our Behavioral Health Division Manager with our Health and Human Services Department. He's got some great information to set the stage for us tonight. So Nick, can we hand this over to you?
Sure can. Good evening, everybody. As Philip mentioned, my name is Nick Oconne, and I am the Behavioral Health Division Manager with the county. I use he, him pronouns, and I'm going to be talking a little bit about mental health and our county's mental health programs this evening. I think we can go to the next slide. All right. So to get us started, I wanted to have a little bit of a conversation about mental health and behavioral health, and to make a little bit of to distinguish between the two, so that when I'm using these terms, folks really know exactly what we're talking about. And so with behavioral health, this is an umbrella term that involves the promotion of mental health, resilience, and well-being. It includes a treatment of a full spectrum of behaviors and conditions related to both mental health and addictions. And specifically, when I'm talking about addictions, this includes programs that address both substance use disorder and also programs that address problem gambling. When I talk about mental health in particular, this is an individual's overall well-being in relation to their biology, their environment, and how they interact with the world. And I really like this definition because it puts things in really nice language and also really makes me think of it as a spectrum of wellness related to one's mental health and the different variables that could impact that wellness. I really want to focus a little bit on the interaction with the world and how that impacts somebody's mental health, just recognizing that over the past year and a half, we've all fundamentally interacted with the world differently, and that this has no doubt had impact on people's behavioral health, particularly related to the pandemic. Many people have lost folks that they care about. Many people have lost activities that they care about. And this interaction of the world we recognize has absolutely had an impact on the mental health and mental wellness of our community. Today, we're really going to be talking a lot about Washington County's mental health programs and the community services that we offer within our behavioral health division, really focusing more on the mental health than the behavioral health terms, even though it's living within our behavioral health division. Next slide, please. So as we're starting this conversation, I want to have a little bit of a conversation about what is Washington County's role with relation to mental health. And it's important to note that the state establishes the county as the local mental health authority, which is charged with ensuring that there's an operating community mental health program, which is really a safety net that's available to all of the community members of a particular county. The county has delegated this function of the community behavioral health program to the behavioral health division, and it's one of the two primary functions that we have as a behavioral health division. The other one of which is that we have the delegated responsibility of providing high needs care coordination on behalf of two of our local community care organizations. And when I mention community care organizations throughout the presentation, it's really referencing the entities that manage the Medicaid benefit for community members on the Oregon Health Plan. When we're talking about the community mental health program, we offer a wide spectrum of services under that community mental health program, and it includes both programs addressing mental health and also substance use disorders and problem gambling as well, as I had mentioned earlier. Next slide, please. So when we're looking at the core functions of our community mental health program, there are numerous functions that we have, but for the sake of time today, I'm really going to focus on these 5. The first of which is the function of civil commitment investigations and hearings. Our state delegates the responsibility of investigating notices of mental illness to the county. These notices occur when there's concern that one of our community members is potentially at a danger to themselves or others due to their mental illness. Our staff are charged with starting that investigation and determining if a hearing is necessary to see whether or not somebody would potentially meet criteria for commitment. Over the course of a year, our staff investigates approximately 900 notices of mental illness. And of those 900, approximately 12 of these annually lead to a community member being involuntarily committed. I wanted to mention the involuntary commitment a little bit because it's one of the very few circumstances where an individual's engagement in mental health treatment is involuntary, versus voluntary. The vast majority of times that folks are participating in our mental health programs that we'll be talking about today, it is a voluntary engagement, except in these certain circumstances that I was referencing, and a couple other circumstances as well, Another function of our community mental health program are our protective services responsibilities. And our protective services staff here at the county are responsible for investigating abuse and neglect and ensuring that protective services are provided and in place for vulnerable adults with severe and persistent mental illness who are engaging in our behavioral health programs. At the county, we operate a protective services line that is staffed by our staff members who are charged with investigating claims of potential abuse and neglect of our vulnerable community members. Another core function that we have within our community mental health program is our crisis response responsibility. We're charged with having both a crisis line that is available to all community members in place 24 hours a day, 7 days a week, in addition to a mobile response team that's able to respond to community members when needed anywhere in the community 24 hours a day, 7 days a week as well. We have a full spectrum of crisis services as well that I'll talk about further at a later time and in one of the other slides. We also provide services for low-income residents with significant treatment needs and who have no insurance or are underinsured. We don't offer these services, we don't provide these services specifically through county staff, but contract out to a comprehensive behavioral health network that includes both mental health providers and also substance use treatment providers as well. It's important to note that we contract with a host of culturally specific provider organizations who are able to provide culturally responsive treatment to our community members and to do it as often as possible in our community members' native languages to help them engage in treatment. The final function that I really want to point out is our responsibility around local planning. We're tasked with partnering with our local community, our coordinated care organizations, to monitor the system and identify needs and areas of improvement that we have within our behavioral health system. It's really a process of ongoing quality improvement to ensure that we're not just meeting the needs of our community today, but that we're working on meeting the needs of our community in the years going forward. Next slide, please. With this next slide, I really want to highlight one of our really exciting programs that we have that's unique in our county, and it really highlights the strong relationship and collaborative spirit that we have with our Washington County Sheriff's Department. We've been closely collaborating with them, the Sheriff's Department, for the last 20 years, and the Mental Health Response Team is now in its 11th year as a program. This unique program pairs a trained mental health crisis clinician with a Washington County Sheriff's Deputy. And what this does is it provides direct collaboration between dedicated law enforcement officers and behavioral health professionals for the best outcomes in emergency situations. We recognize that oftentimes in a crisis situation, there is potential safety risks, and our clinicians who are on this team feel incredibly supported knowing that they have the support of law enforcement so that they can deal with any situation that might come up, and that they're able to engage with our community members when they're potentially at their most vulnerable time. The service to the community members begins on patrol. It's dispatched through 911 and includes assessment and engagement with a trained clinician with the goal of a crisis resolution and connection to necessary resources. This is called the Mental Health Response Team, but the goal is not just to respond to a crisis situation, but to really intervene in that crisis situation, to do everything we can to safely resolve the crisis and also work on connecting somebody to the next appropriate level of support that they might receive in the community. In the rare circumstances where law enforcement does need to take somebody into custody, this team is able to stay in contact with them while they're in custody and also work on connecting them to treatment and supports following their release. It's a really unique program, and it's been really fantastic to see how it's grown in the community. This program is in fact growing, and we currently have a member from the Hillsborough Police Department who's going to be joining the team. And we have plans in the works to also add members from Beaverton, King City, Tigard and Tualatin, actually Forest Grove, and also with the TriMet Transit Police as well. This is going to truly make this a multi-agency effort with collaboration across the different municipalities and law enforcement agencies that are serving our community members. And it's incredibly exciting. With it being incredibly exciting, it's also really important to temper the timeline related to this expansion because of a current behavioral health workforce shortage that we have. We currently have the clinician positions for this team advertised. We're very excited to work with LifeWorks, our provider, to be hiring them. But we have a workforce shortage that is not just localized to the metro region in Washington County, but also throughout the state of Oregon, where we have multiple community mental health providers who have multiple vacancies and are working really hard to do everything they can to hire those vacancies. But we've really seen the shortage be pronounced throughout the pandemic. Next slide, please. This next slide really highlights some of the services that are delivered and who benefits from those services in our community. And it's really lifting up and highlighting our crisis services in particular. Once again, I mentioned that we have a pretty comprehensive array of crisis services and supports offered to all community members in Washington County. And we're just going to talk a little bit about those specific programs and also how many folks that they're supporting on an annual basis. The first support I really want to highlight is our Washington County Crisis Line. For folks that don't know that, Know that that number is 503-291-9111. It's included in the last slide of the slideshow, and it's something that I suggest that everybody has, handy all the time, not just if they were to ever need it, but also if they were to have a loved one who might need it as well. This crisis line is available 24 hours a day, 7 days a week, and it's integrated into our other crisis services in the county. The line is staffed by master's level clinicians who can provide crisis intervention, assessment, and also connection to services for the community members who are calling. Each year, the Washington County Crisis Line receives approximately 16,000 calls from our community members, and it's a valuable resource to Washington County. Another part of our crisis service array is our Hawthorne Walk-In Center, which is located right off the Hawthorne Farms MAC station in Hillsborough. This is a behavioral health urgent care center that's open 7 days a week and provides in-person assessment and triage, crisis intervention, and short-term services in connection to ongoing treatment. Every year, this support has approximately 3,800 individuals who engage with it, and it provides about 5,500 individual episodes of care throughout the year. We opened this program about 4 years ago, and it's been an immediate and valuable resource to our community since it opened at that time. Our mobile, I have a couple of more if somebody wants to go back just for a second. Our mobile crisis team is, as I mentioned briefly earlier, it has master's level clinicians who work within the Hawthorne Walk-In Center who can provide in-person crisis response wherever an individual is at, including at their residence, in the community, or even in the jail. Every year, this program supports about 450 individuals, or 440 individuals, excuse me, and we have learned that about 9% of the calls to the crisis line require some sort of in-person response. The last program on here is speaking a little bit more about the mental health response team, which, as I mentioned, pairs a crisis clinician with a law enforcement officer to provide that co-response to 911 calls, as I mentioned. Every year, this program provides about 850, provides support to about 850 individuals and responds to about 2,000 calls on an annual basis. We recognize that that volume will likely go up as we're partnering with more law enforcement agencies, and they're being dispatched to additional 911 calls in the geographic area of those law enforcement agencies. Now I'm ready for that next slide. With these next couple of slides, we're going to really highlight the intersection between mental health and homelessness, and to talk a little bit about the supported housing services that are being developed here at the county. We've recognized for a number of years, and it's been a part of our last 2 strategic plans, the importance of developing housing resources for community members with mental health needs, and how this is one of the key barriers to folks both achieving and also sustaining treatment success as they're engaging in behavioral health treatment. In May of 2020, there was a voter-approved measure that really prioritized housing and services for people with disabilities who are experiencing prolonged homelessness, and the first round of investment is set to hit our county in just next month, in July of 2021. This is a really exciting 10-year funding stream with the goal of creating 1,665 supported housing placements in the county and increasing our shelter capacity to 250 year-round beds. All programs are going to be leading with race and equity, with a goal of equitable outcomes across a diverse set of community members and groups. Next slide, please. So looking a little bit closer at mental health and homelessness and the supported housing services, this slide is really showing some of the different components of the supported housing services that are residing within our housing department, really highlighting housing case management, wraparound supports, and long-term rent assistance. There's a star next to the wraparound supports, which is where I'm going to spend a little bit of my time, just because we recognize that that's where the largest intersection of mental health and housing supports live. With these wraparound supports, when we're talking about them, we're really talking about community-based health and mental health and peer supports, addiction and recovery services, connection to employment and education supports, and also connection to disability benefits and legal advocacy. Really looking at what kind of supports are going to help both establish and sustain a successful long-term residence for our community members with mental health who are engaging in these programs. The Behavioral Health Division has been participating really closely with the Housing Department on the supported housing planning and the implementation, with the acknowledgement, as I was mentioning earlier, of the frequency that houseless individuals have with a co-occurring behavioral health condition. The Department of Health and Human Services actually hired a staff person to act as a liaison between HHS and the Housing Department, really with the goal of positioning this position as a bridge to the supported housing services developments and the existing services and supports that are already provided by Health and Human Services. This position is really focused on ensuring that existing efforts are leveraged and complemented as new supports are developed. We're really excited about these supports, and we're really excited as well about the partnership that we're able to have with housing to be able to meet the needs of our community members. And with that, that is the conclusion of this presentation. There's so much more that I would love to talk about today, and I just appreciate everybody who's been with us this evening for this town hall. Thank you.
Thank you so much, Nick. That's a lot of information, fundamental to understanding this whole area. And we really appreciate you and all of your staff who are contributing to our community every day. Thank you so much. And what we want to do now is pivot now to our question and answer period. But before we do, I would like to invite Jennifer to make her announcement one more time, just in case anyone who would prefer to engage with our board in Spanish may have joined us while Nick was talking. Jennifer, would you mind making your announcement one more time?
And Philip, while we're waiting for Jennifer, will you remind people who are joining about selecting the English channel?
Yes, I can.
Typed in the chat that you need to take her off interpretation in order for her to make the announcement.
Thank you, Chair Harrington.
Yeah, and while we're waiting for Jennifer to come over, anyone that's joined us already who would prefer to hear the rest of the proceedings in English, you can just go to the globe icon there at the bottom of your tray in our Zoom display and select English, and that'll enable our Spanish-speaking participants to ask questions real time. So we're all on the same page.
Philip, thank you so much. So can you hear me? Yes? Okay, great. Thank you. And thank you, Catherine, for voicing my chat. I really appreciate that. Así que buenas tardes. Les voy a recordar cómo accesar el canal de interpretación. En la parte inferior de su pantalla deberían de ver un círculo que dice Interpretation. Seleccionando ese icono van a tener dos opciones. Una es English, la otra es Spanish. Asegúrense de seleccionar Spanish, que significa español, para poder escuchar las preguntas en español. Y si están en un teléfono, pueden tocar su pantalla una vez. Les van a aparecer 3 puntos en la parte inferior a mano derecha. Seleccionen esos 3 puntos y después va a salir unas opciones. Asegúrense de seleccionar Language Interpretation, que significa interpretación de lenguajes. De nuevo, cuando lo seleccionen, van a tener dos opciones, English o Spanish. Asegúrense de seleccionar Spanish y de apretar el botón en la parte superior a mano derecha que dice Done, que significa terminar, para que así se apliquen los cambios. Si tienen preguntas accesando, nos pueden dejar saber en la caja de charla para que les podamos ayudar. Y si alguno de ustedes tiene alguna pregunta o duda, también pueden levantar su mano virtual y la pueden decir en español y las intérpretes se van a encargar de interpretarlo al inglés. Muchas gracias. Thank you so much. Now I'm ready to be assigned as an interpreter again.
Muchas gracias. Thank you, Jennifer. And so as she returns to the Spanish-speaking side of our community meeting tonight, let me just walk through a couple of the procedures here. The balance of the time, we have just about a full hour to engage with our board. That's really the heart of this session, this town hall, is to get a dialogue going with our community on this important topic. And what we want to do is make sure that you let us know which board member you are interested in asking your question of or making a comment to. You can use the raise your hand function that's also down there in the bottom of your Zoom session, or you can go into the chat to put your question in there. And we are trying to keep to one question or comment per participant so we can make sure we get all the way through. But I'm going to get some helpers here to help me identify different folks that are lining up right now to ask questions. And let's see here. I think we're ready to roll. Let me just full screen it so I can see everybody. And I am not seeing any hands raised, but maybe someone else can. Do we have any questions for the board? Okay, it looks like Sally has raised her hand. Could we have Sally ask her question, please?
Okay, let me go ahead and unmute Sally so she can speak.
And while we're doing that, we have a little timer just to make sure that we maintain the equality here. So we'll get that moving.
And Sally, you are unmuted, so you can start your question when you're ready.
All right. I'm Sally Reed. I live in Aloha. I have someone who's currently in the Oregon State Hospital. And my question or comment to the board, and it could be to anyone, is there is quite misconception around mental health and what that really means. And I think we have to do a better job in our communities of explaining what mental health looks like and is, that they're not drug addicts necessarily, or someone struggling with an addiction or a theft problem or a sex offender, but can be any one of us. This past year has created a lot of trauma, and I think we need to address that in our communities because a lot of people are overreacting due to trauma in their past. I just think we have to educate our public a lot more, especially around the housing developments that are going on in our communities. There's a big uproar about Clover Court. There was one now going on about the Aloha Inn. In my opinion, those are much needed services and have been way past overdue. So I just want to make the comment that this meeting is very important, and I hope that we keep talking about this issue of mental health and trauma that's occurred in all of us over this past year with COVID issues.
Thank you, Sally. Why don't we start with the chair, if you don't mind, Chair Harrington, if you wanted to give your response.
Thank you, Sally, very much for bringing to life how mental health takes many forms, and it involves all kinds of different needs that people have in different parts of their lives and aspects of their lives. You sound very well informed. And so if you're interested, I would be interested in getting together with you to see what your ideas might be for how we might go about doing that. I know that I learned a lot joining one of the public meetings that the Board of Commissioners had during the Clover Court experience or proposal timeframe. And I was the only member of the public at that particular meeting, but it helped me learn about the organization called NAMI and their Oregon chapter, and really touched on various mental health needs of people in our community to help ensure that everyone has the opportunity to prosper. So thank you again for coming tonight. And I won't count on your having access to the chat, but to reach us at the board, you can send an email to bcc@co.washington.or.us. And to reach me, it's chair at that very same address at co.washington.or.us. Thank you again, Sally.
Thank you, Chair. Are there other board members that wanted to speak to Sally's comment or question?
Yes.
Go
Philip,
ahead.
can you hear me?
Yes,
Yeah.
Commissioner Fye, please go ahead.
Hi, Sally. Thank you for the great comment and encouragement to our board. When I attended the ALOA meeting, one of the clear message that came out of from that meeting was the need for Washington County to deploy educational campaign around this whole issue. I think it's important that we bring both sides, and I want to make sure as your county commissioner that we don't repeat history, and meaning that we don't pit people against each other. I heard some of the neighbors' comments around, who are the folks that we're going to place in the Aloha Inn Hotel, the future tenants, and some of their backgrounds. And I think that's a lot of fear tactics. That's sort of, to a lot of people, it's real. But it's also really, from my take as personally, it's, movie based, but it's a real fear that people have. And I think it's one that can be eradicated or really eased from an educational lens to educate people and to really let them know we can't tell people who are homeless to go home when they don't have a home to go to. So I'm really committed as your county commissioner for our district to make sure that we really have a robust educational campaign and plan to bring both sides together, to listen to each other and to address our concerns together, and to make sure that, we're creating a community that will work together. So I heard your comments, and I really look forward to having further conversations both with Washington County and folks in our district to address this issue.
Thank you, Commissioner. And I'm just checking here. I don't see any raised hands just yet, but I'm wondering if other board members wanted to provide additional comments.
Sure, Phil. I'll jump in. This is Roy Rogers. The issue of mental illness has certainly come on a long road since I was a kid. We didn't understand that it's just like any other thing that can go on in your body. We certainly didn't think of anything about going to the doctor for flu or going to the doctor or polio shots in those days when we had them. There's a number of things that were just common practices, but somehow with mental health, we stigmatized it. I spoke on this issue about 3 years ago in the state of the county. And I, just for the record, I've been a NAMI supporter for several years financially. We really have a broader issue than just, in my opinion, I'm probably an outlier on this, and that's okay. It's just not county funding. We need to figure out how to get insurance companies involved. This ought to be an insurable, mental health should be insurable like any other health issue. And so we need to somehow determine how we can have insurance providers provide services so that they can be a part of the solution. And was mentioned earlier, there's all kinds of mental health issues. Sometimes it's addiction, sometimes it's gambling, sometimes it's alcohol use, and sometimes it's just people who have suffered some illness that has created some depression or some difficulty in their lives. So if I could say anything, it would be two things. One, we need to quit with the stigma. I mean, we need to get over that and just understand that it's a health issue like anything else. And secondly, others may disagree. I think the insurance companies need to come to the table and say this is an insurable event. and they ought to provide coverage for folks who are in desperate help. So that would be my comments, Phil.
Thank you, Commissioner Rogers. Anyone else wanted to tag on that one? Go ahead, Commissioner Treese.
Sally, I wanted to thank you for bringing forward your question. And I just wanted to make sure that you knew that this Board of Commissioners is very well aware of the issues that we face with behavioral health and mental health issues. It is a struggle. It's been a struggle for a very long time, since the 70s, when a lot of our programs were defunded, and we are still paying the price as we move forward through this. But I'm encouraged by seeing our mental health teams that are working with our deputies. I'm encouraged by the work that's being done through our Health and Human Services Department. But as we all know, it's not enough, and we have to continue to push forward. But thank you for being here tonight, and thank you for bringing forward your questions.
Yes, thank you very much. Commissioner Willie, did you want to round that out?
Well, I think that I think everybody's touched on this. I think that's what the exciting thing about the Supportive Housing Services initiative that was passed last year. It's going to provide much needed funding, and we're going to see, I believe, a significant increase in the services and the assistance that we can provide, as has been defined tonight with the mental health and the behavioral health, and that was an interesting differentiation of a description of that. So no, I think our team is more than ready to use this new funding source and certainly significantly enhance our services in mental health.
Thank you. And I saw that we had a chat there while Sally was talking from Preet, just echoing what Sally has to say. So we appreciate that comment, and any other comments that we want to make about any of the topics or perspectives on these topics that our participants here today want to put in the chat or raise their hand to address their board. We have the entire Board of County Commissioners here, the policymakers that set the priorities, help us funnel resources to the various problems facing our community. This is a great opportunity to engage with them about any of the things you've heard already on any side of it that you wanted to bring to their attention. So I'm looking forward to our next question or comment. Going once, going twice. Let's see if there's anything, while we're waiting for some comments, if there's anything board members had a question about themselves that they would like to explore, having heard Nick's presentation, for example, if it sparked any thoughts in your mind while we're waiting for some more questions to come in. Anyone wanted to talk about that? Oh, and Chair Harrington's asking, are there any questions in the Spanish channel? We're happy to hear from anybody in that part as well. And I hear now that we have a question here about will Washington County be dedicating any of the American Rescue Plan funds to mental health, behavioral health services? That's a good question. And I'm not seeing who it's directed to, but Chair, do you want to start that one as well?
Well, your Washington County Board of Commissioners has just begun the process of engaging with staff about the utilization of the ARPA dollars. As you may know, over the course of the program, Washington County will receive $116 million So $58 million the first year and 58 the second year. One of our primary responsibilities is to make sure that we provide for the public health needs of the community as COVID continues to be present in our community, and to complete the vaccination effort that is going on so that everyone has the opportunity to be vaccinated. So a large majority, we just had a presentation with the board last Tuesday. So you can find materials on this in our board packet from our meeting of June 15th. So there you'll see that thus far we're estimating about 40 million of those dollars will be needed to support public health. During the first year of the COVID pandemic, our team did make additional services available for mental health to try and ensure that people knew they weren't alone and that there were resources to access. So mental health continues to be a component of that. But where our heart really is to make sure that we have a more comprehensive and long-term plan and approach, such as Nick highlighted in Mr. Oconne highlighted in his presentation, that we want to expand our mental health response needs and crisis needs, but we have a challenge with the workforce. And with the supportive housing services measure, we have additional funding as well, but we need to make sure that we are supporting people who are interested in working in the field, but also expand the number of people who are able to provide culturally relevant and culturally specific mental health services, so that no matter what language, what background people come from, they get the care that they need. So I'm not able to speak to specific line items, but rather leave you with a broad brush that we have identified that there are categories of needs, and we're looking to mobilize different funding solutions to address those needs. Unfortunately, as Nick and Philip highlighted, we need to help fill that pipeline of workers. And we're working with community colleges, universities, Work Systems, Inc. to try and ensure that we're able to get more workers trained up to do this vital work. Thank you very much for your question, Megan.
That's great. Thank you, Chair. And we do have a little more activity now. This is great, but I don't want to stop this particular dialogue here. If there are other commissioners that wanted to respond to Megan.
Well, I think it's interesting that our chair's answer to Megan also included parts of the next question from Carol Greenow about the new and expansion programs. We're needing workers, and how can we train and recruit people to serve all the diverse parts of our community? The county has always had a really good relationship with as the chair mentioned, with the community colleges, with Work Systems, Inc., and has been proactive as long as I've been on this commission in terms of providing support to those programs to make sure that we've got the workers trained, not only for the programs, but to retrain people that need jobs, that have the opportunity to move into different positions. So we've actively supported that type of transition. But Carol, you're absolutely right. This is going to be a tough one, and we need to make sure that we have enough people that are ready and able to take a role in this whole realm of serving behavioral health and mental health issues. The other thing I do want to mention, as the chair said earlier, the $40 million for HHS includes behavioral health as well. So that we've got, I believe, with the ARPA funds, with the commitment that we have to retraining workforce in relationship to job opportunities, I think we're well positioned moving forward. But it will take some time. It's not something we'll hit right overnight. But it is a goal, and it's certainly recognized, as I mentioned before, by the Commission, that this is a key issue that our communities are facing across the board. This is very true in our in all of our communities.
Thank you, Commissioner Treese. And I want to circle back to Carol's question about workforce in a moment. I know that we have a lot of passion on this board about that topic, but I wanted to go next, if there are any other comments here, just looking at my board to make sure, to go to Michael, who had a question just before Carol. Without objection, I'll just read here what Michael has asked. He's saying, what is being done to ensure that supportive housing is evenly spread throughout the county and not located in a single community within the county? And that he's not directing to anyone in particular, but I'll look to the board to see who may want to answer that one first. Anyone want to raise their hand? There's Commissioner Willie. Please take the floor.
Thank you, Philip. I wanted to get ahead of the line because I know everybody else is going to join in. That's a conversation that we have, I think, about county services in all regards. We want to make sure that we provide any of our services, not only on public transit avenues, but certainly in a variety of locations throughout our county. And that's a critical factor. We know that we cannot locate services specifically out here next to our Washington County facilities in Hillsborough. We know we need to make sure we take care of all of our residents, certainly in Washington County. And I think, if honestly, probably Commissioner Rogers is one of the biggest advocates for this. He is constantly watching for where we're providing these services and making sure that we have equity throughout our entire county. But it's a top level priority, and we're certainly focused on that. So thanks for the question.
And on page 10 in the presentation tonight about the mental health and homeless and the supportive housing services, it's mentioned that all programs will lead with racial equity and ensure equitable outcomes. And that's true in everything that we're doing these days. So the delivery of the process is meeting people where they are based on what their needs are. So, and I think that that's a really important component here.
Thank you. That's helpful. Go ahead, Chair Harrington.
So I think our community will start to feel more comfortable about our follow through on this as we build out more of the affordable housing bond projects, and people are able to see them spread throughout Washington County, as well as with the different programs that are hosted in different locations for providing the supportive housing services. Some of the services may be provided right in these apartment complexes, for example, but other services may be provided at other facilities, whether it's someone going for educational training at a training site, or seeing a mental health specialist through an office setting. So not all the services are going to be provided right with the actual housing, but we are, as highlighted very well, we are trying to make sure that we are meeting the community where it's at, no matter where people may be living. Thank you.
Thank you, Chair. And with that, I think I'd like to go now back to Carol's question that Commissioner Treese started a robust response to a second ago, just to read it so that everyone on YouTube can also hear it. And I've read her question a couple times, and I think she may be referring to part of the presentation Nick gave about the pipeline, the shortage of qualified staff in this particular area of mental health services. So here's what Carol says. She says, with many new and expansion programs needing workers, how can we train and recruit people to serve all the diverse parts of our community? Can we pay enough to recruit and retrain workers? That might be retained, but I'm not sure. In any event, maybe it's retrained. It might be both. In any event, let's see what our board says to that particular question. It's an excellent point, and it was, like I said, brought up in the presentation that Nick provided. Go ahead, Chair.
Well, I will say, just trying to speak from data about what we've been doing in recent times so that you're assured we're serious about this. As part of the utilization of the coronavirus relief funds, you can see a section of our easy to read report titled Lift Us Up, Keep Us Going, that part of the dollars that were available for workforce training did go to provide, what's the phrase, onboarding training for people who wanted to start a new career in any kind of medical health field. So there's just an example right there within the last year. On the question of can we pay enough to recruit and retrain workers? This is a problem that we're working at our regional level, for example, through the Supportive Housing Services Regional Bond, because pay equity is part of that, but also at the state and federal level. So there are conversations happening at all levels of government about how do we make sure that the experts we already have in the field get the better support they need, because they're dealing with trauma on a day-to-day basis. So how do we make sure we're not burning people out? But also, how do we make sure that we are building that workforce? We don't have the answers yet, Carol. I'm not trying to pull a fast one on you at all or lead you to think we do have the answers. But we do know that in order for us to have a larger workforce and a sustained workforce, that we have to be working together to solve these needs. Thank you.
Thank you. And Carol pointed out she meant retain. So it's not just about the recruiting. We need people to stay in those jobs because this is an area of need, just as you're saying, Chair Harrington. Commissioner Rogers, I see you've unmuted. Did you want to answer some to this?
Sure. I maybe come at it from a little different perspective than maybe what she meant, but I like the retrain and I like the retain both. I think it's a larger question. And the answer is absolutely not. Do we have the money? No. But I think that, and this is my personal belief, not the board's, that we've missed the boat for a long time and not coupling more with our business community to train people for the jobs that they have. We've got to get rid of the stigma that the trades is a bad thing. It's not. It's a wonderful thing. Well-paying jobs. Go out. If you're a cement layer, you're a brick mason. If you're a person who can do welding, you won't believe the number of people who will try to hire you. And our problem has been is that we've not really coupled. We have a fragmented system of employment agencies and people getting general vocational kinds of classes, if any, and they're really not ready for the workforce. We have a tremendous number of jobs. All we need to do is retrain some displaced workers. These are folks who got into industries that either are disappearing or maybe they don't have the skill sets for the next job. So we need to retrain. And the retention is not the problem if business invests. So if I had my dream and I was king for the day, I would somehow have a program at about the junior level of the high school where people would have a lot more vocational training, and they would be coupled through systems that we could develop very easily. Work Systems is a good example. Pam and I serve on that board where we could couple people with jobs. Employers don't want to lay off people who they've trained. They got too much investment in. So we just have to get them to invest in those young people, 18 to 24, and those displaced workers from other industries. Invest in them. And I think with a little government help and a little nudge, we could get them to do that. And we would have then not anything that the taxpayers have to come up with money to sustain. Private industry would sustain it over and over and over. So I guess I'm advocating for a whole bunch of different change. But if I had my king spectrum or whatever you have, maybe a crown, I don't even, never seen one, but maybe I have one. That's what I would advocate for.
Thank you, Commissioner. That widens the scope in terms of the response. I think you're reaching not only to the mental health employment needs, but I think you've touched on the trades and some other aspects of the labor economy. I appreciate that response. I'm hoping now we've got a question in Spanish, and I see your hand there, Commissioner Willie. We got a question that came through chat in Spanish, so I'm going to have our interpreter come back out of the Spanish channel. Commissioner Willie, did you have something quick that you wanted to tag on to that last one, though, before we have Jennifer provide a translation?
No, thank you, Philip. Let's go ahead. I do have some more comments about workforce training and certainly opportunities that we took advantage of through the CARES money. But let's move into this next question.
Okay, I appreciate that. And Jennifer, are you able to help us English speakers understand the question from one of our participants here? I don't see a name, unfortunately.
I can go ahead and do that. This is Rosie.
Oh, Rosie, thank you.
Okay. Since we are talking about mental health, there's so many people that lives out on the streets. They had mental problems.
I'm sorry, I thought I heard Rosie. I didn't want to. I didn't want to have both of us speaking one over the other. Okay, so this question says, I know we are talking about mental health and how a lot of people that are homeless have mental health problems. But what is being done to these people that commit crimes or when they're in public places that sometimes endangers children, like schools or parks, where some of these people do drugs in broad daylight?
Thank you, Jennifer and Rosie, for pitching in there.
Sorry, can you guys can assign me as an interpreter again?
Okay, thanks, Jennifer. I think we had the question. Did everyone hear that on the board? So this is a question that recurs throughout the community, and we're hearing this question from a Spanish speaker participating tonight. Any thoughts on this particular aspect of the topic we're talking about this evening? Go ahead, Chair.
Well, it was a multi-layer question, I think. It is true that we have more property crime happening because we have an increased number of people who are suffering from substance use addiction, and oftentimes substance use disorder and mental health, it's not that they go hand in hand, but there is data that says that often people are suffering from both situations. One aspect of the question is, are people being prosecuted for crimes that they commit? And the justice system does move forward. What we're trying to make sure, though, is that as people who go through the justice system need mental health treatment, that they get that treatment. And that is one aspect of the program that we're trying to make sure is in place and is more available than it has been in the past. And if, for example, people go to jail, we do have substance use treatment available to them as well. But part of people's success is making sure that they get the continuous mental health support that they may need, not only while they're justice involved, but once they return back to the community as well. And this is where we need to make sure that there are more mental health support systems in place. It's multifaceted. I'm really pleased that we have the subject matter experts that we do here at Washington County working in our Health and Human Services area, such as Nick, who presented earlier today. So I don't know if I answered all aspects of the question, Philip, so do feel free to remind me or remind us of other areas that I might not have done a good job of addressing.
Oh, I thought you did a great job, Chair. It is a multifaceted issue, and the question was presented that way. I think there was also mention of protecting children, and I know that's a high priority community-wide. That's a strong community value. So I thought you did a good job there, and I'll offer to any of the board members that wanted to also remark on this question that we just had. Okay. So thank you, Chair. And let's see, I have Sally came back through. She wants to ask another question. But I wonder if there isn't anybody else that wanted to take a turn before we give Sally a second turn, which is completely fine with me if we give Sally a second turn. All right, and I'm not seeing anybody. So let me read Sally's second question and encourage anyone else to ask more. But Sally's saying, will current mental health foster homes get some of these much needed funds to stay in business? The state of Oregon restructured the payment to these angels who house those who struggle with mental health but need a safe place to live. We can't lose these valuable assets in our community. So mental health foster homes is the topic here. How can we better support that area? And I know this is a shared area, I think, with state funding as well. Go ahead, share, Willie.
I was just going to jump in here and say that I think it's important to remember that we're just in the beginning of the discussions around how these ARPA dollars will be spent. So it's a great suggestion, and it's something we need to keep in mind as we move forward. And I couldn't agree more about the fact that these foster homes and the people that operate them our angels. And I agree 100%. And I appreciate the reminder to us to keep that in mind as we're going through the process to determine how this money is going to be spent. We're at a high level now and moving down through the process, but coming out of the pandemic and into recovery is the goal over the next couple of years.
Thank you, Commissioner Treese. Commissioner Willie, did you also want to comment?
Yeah, I think from my perspective, this is a subject matter that will require, at least from my own personal standpoint, a significant amount of homework and research, because it is not a singular aspect of mental health, and it certainly has a number of tentacles to it. And I think that's what we're finding out. And the good news is we've got this supportive housing services money that is now available. It gives us opportunity to not only study and provide these services, but really a broad range of these services. So I can only say that I think there's a number of things that we will be able to accomplish and learn in this entire process. And fortunately, we have the funding to do that. So I'm looking forward to how we can spend the next 10 years with the funding from this to study and certainly enhance our mental health services.
Thank you. And while we're waiting for any more questions, I think we have about 10 more minutes here before we were going to wrap up. I noticed that Megan also had a comment earlier about thank you for the work you're doing on expanding these services, especially regarding homelessness. We've seen a high need for these services in our winter shelters. So I just wanted to acknowledge that comment and thanks. And open the floor once again for anyone participating to have some dialogue with our commissioners on this important topic.
Well,
Commissioner Fye. Yes,
yeah,
please.
I'm wondering if Sally can type in a little bit of clarifying on the question that she asked around the funding. Sally, were you referring to the supportive housing services funds, that investment, or were you talking about the American Rescue Plan Act funds? Because that's the interesting. You mentioned the foster care and the state piece, and I wonder if there's an opportunity to push the state to and reach out to our state legislators, especially for our district, Lindsay Campos, and our Senator Kate Weaver on that issue. But I was just wondering on my own curiosity, which of the funds were you were referring to?
Now, I don't think it was specific to any of those at all, but rather that the state reimbursement rate and payment rate to the service providers has been reduced through the budget, much like we've experienced with community corrections.
Sally is unmuted here if you wanted to address your own intent there with that question.
Yeah, I was just going to say, Catherine, you hit that right on the head. It's more about what the state has done in reducing reimbursement back to these individuals that run these homes, and just the restructure.
Thank you for that clarity. Other thoughts here? Other questions as we move towards the end? This is a great opportunity, and I do appreciate all the interest here and good conversation. Yes, go ahead, Commissioner Treese.
Well, I just want to say thank you to our audience for participating tonight. This is probably one of the hardest days to stay focused on anything when we're looking at the temperatures that we're looking at. So, I don't think if we end early, I don't think it's going to bother anybody. And maybe it's another sip of iced tea with an extra dose of ice cubes will help. But I also do want to remind people that Washington County does have cooling centers open, and if you know anybody that needs that service, it's on our website. So just a little public service message there as well.
Yeah, we're just as we've begun, we started at 115 degrees, and I just checked and we're down to 109. So see what you've done, board. You've lowered the temperature for the entire community.
Bring in the coastal offshore breezes.
Exactly. Well, let's see. Oh, go ahead, Chair.
No, I just have a brief wrap up, so I wanted to make sure I got that in.
Yeah, why don't we do that? I'm just going to point out that Carol said thank you for our commissioners for your passion to serve the most vulnerable, your openness about what we need to learn, and your continued support for our growing services. So I just wanted to read that out there. And I do want to give the board a chance to give some final comments here. Let's see. And Chair, if you don't mind, we had planned to put you last, so you would have the last word. Are you okay with that? Okay. So what we'll do is I'm going to start with Commissioner Fye, if you don't mind, Commissioner. Just any parting comments here, and we'll go through. That's a numerical order. We start with Commissioner Fye in District 1. We'll end up with the chair, and then I have a couple last minute, housekeeping things to pass along. But with that, Commissioner Fye, would you like to leave us with some of your thoughts here as we depart?
Yeah, thank you, Philip, and thank you to you, Philip, for moderating this great town hall. You did a great job. I'm really glad to see that we have ASL interpreter going, and also our Spanish language interpretation available to any of our residents in Washington County. As a mom with a son of hard of hearing, I'm always really excited to see ASL in any interpretation services available. I wanted to say this is really a great town hall. It's my second town hall as a commissioner for the last 6 months. And this is a really great topic and dear topic of mine, and really appreciated the questions that was asked. And I did more listening tonight intentionally to really hear some of our concerns, and especially to peer up the conversations that we'll definitely have around Aloha Hotel and how to mitigate some of the concerns our neighbors have in terms of their own safety and also the safety of the neighborhood. I wanted to say the question that was asked around the funding for mental health piece, and if some of the ARPA money will go. The chair talked about the board presentation that we had, and I definitely can say I certainly hope some of that money goes into mental health, and I feel comfortable to say that it will certainly go to mental health, because I was part of the contact tracing management here for Washington County. I know one of the things that wasn't really anticipated was the mental health impact of the coronavirus. And we saw, and especially the team that I managed, we had our county staff, Nancy Griff, who provided, luckily, a training, mental health training around suicide prevention the day before one of my staff got a call of somebody who was impacted with coronavirus that said they're thinking about committing suicides and having thoughts about that. And had not my staff got those trainings, I don't know how we would have all of us dealt with. So I definitely feel like we really do have to invest in mental health, not only to only our community, but to also our own staff here, because trauma does transfer and it does go both ways. And in terms of the question around the supportive housing evenly being spread out throughout the county, I know in my short period of participating in the supportive housing committee, internal committee, that was heavily dominated by the community, which I was really excited to see in early on in my career. One of the elements that was really talked about was the geographic equity of the housing supportive services. So I really hope that's carried out. And I do want to say to the person that asked the question and everyone who's listening, if you disagree anything that the county is doing, reach out to us and send your comments and reach out to the Board of Commissioners and contact us. You know, your voice matters. You need to be heard. So if you feel like we're not evenly spreading out, or one district is getting more services because of whatever, let us know so we can get you the right information and the reasons why that is. But those are my comments, and I look forward to our next town hall. Thank you so much, and I'll turn it to you, Philip.
Thank you, Commissioner Fye. And I'm going to ask, before we proceed to Commissioner Treese, if Chuck, you can just put a slide up on the screen with some resources and some phone numbers there that we can all pay attention to while we proceed with our parting comments. I appreciate very much the experience that Commissioner Fye went through and the crisis that she was confronted with in her team doing contact tracing. Here are some resources that directly address some of what she was talking about in terms of suicide, in terms of other kinds of crisis services that the county provides or we provide in partnership with our community-based organizations or others. Anyway, I just wanted to get that on there so we can see that while we're listening to Commissioner Treese. Please go ahead and take the floor, Commissioner.
Thank you, Philip, and thank you for moderating this evening. You've done a great job. It's much appreciated. I just want to say one more time, thank you to the participants. I hope that what you heard from each and every one of us is a commitment to mental health. There's no question when I talk to my peers on this commission that we are committed. And that commitment follows your commitment. And you demonstrated that commitment through the support of the Supportive Housing Services Bond. So I just want you to know that we listen and we watch what's happening in our communities. And we are the point of reflection for those needs, those concerns, and what you do support. So again, thank you.
Yes, I'm probably next. I would inform you that the less I talk, the more the temperature goes down. It's not 109, Philip, as it is in Hillsborough. It's 106 in Tigard, and going down, as I say, fewer and fewer things. So I thank everybody, and I would echo the others who made their comments already.
Thank you, Commissioner. Commissioner Willie.
Yeah, and I, I don't need to belabor the conversation that we've had. Mental health is certainly a top priority for us as the commission. We've had lots of dialogue about that. And I think, the proof is going to be looking forward to what we actually accomplish and what we do with these funds. So stay tuned and please stay connected with that. We digressed a little bit during this last hour or so to some technical training, and I'd just like to circle back around to that. We committed about $1.5 million to technical training from the CARES money. I think we're going to see more of an emphasis in the ARPA money, and certainly there are plenty of opportunities for technical training at the high school level, and certainly at the, I guess, a couple of years of college level, only it won't be called that. But I think we're going to see a significant increase in technical training across the county. So we're going to be looking for those opportunities and certainly more than willing to invest in those programs. So that's all I have.
Thank you, sir. And that leaves Chair Harrington.
Well, thank you everyone for joining us this evening. I hope that you found the overview information that our expert, Nick Oconne, provided. I know I learned more, and it's always good to get the reinforcement of information, but I really appreciated the dialogue that we had tonight and your questions. We will be having another town hall coming up in September, and I hope you'll join us then. It will be on Saturday, September 18th. But also, you can engage with another high-level elected official tomorrow evening. U.S. Senator Jeff Merkley is having a virtual Washington County Town Hall tomorrow, starting at 5:30 p.m. I was just doing a little Googling on my computer here to try and point you to some easy to find resources to find the Zoom link for that. And unfortunately, it's a little challenging, so I'm not able to just give you that information. But hopefully, if you reach out to Senator Merkley's office, they can get that to you much more readily. Once again, it's tomorrow evening, Tuesday, June 29th, starting at 5:30 p.m. Thanks again for joining us, Philip, and for the widespread Washington County team that helps provide these town halls with all of you. Thank you for a job well done. Always appreciate it.
Thank you, Chair, for supporting, and the full board for supporting this sort of engagement and dialogue with our community. I'm very impressed with the turnout, the quality of the questions. We're going to turn around a set of links on our webpage where you can get to Nick's presentation slides in English and in Spanish. We will have a YouTube archived streamable video link out of this session that I know that others in the community will present. And Chuck, if you advance one more slide, we'll get to the bottom line here, which is thank you. We appreciate everyone participating. And by the way, the town hall that the chair mentioned with Senator Jeff Merkley, we've got the particulars on the county Facebook feed and Twitter feed, but we can put that as well up on our webpage. We look forward to your participation there with our U.S. Senator, but also with the additional town hall sessions that our board will be sponsoring. As Chair Harrington mentioned, Saturday, September 18th and Thursday, December 2nd. Please take us up on this offer. This is an important way to connect with your Board of County Commissioners, to learn about a topic, but also to let them know what you think and to engage in dialogue. So with that, on behalf of everybody that had helped support this effort, we will bid you adieu, and please stay cool. Thank you, everyone.